I'm Lindsay Crane, and I head the content and community teams at Undivided. With me today, we welcome back Dr. Sarah Pelangka. Dr. Pelangka is an educational advocate, owner of KnowIEPs, and a BCBAD. Hello, Dr. Pelangka. Always great seeing you.
Hi everyone.
So Dr. Pelangka, what are related services? And then we're going to get into the specifics of some of them more closely.
Kind of just in a nutshell, related services are any and all services that support a student's access to, special education and specialized academic instruction. And then there's supplementary aids and services which support a student's access to general education. So that's kind of the difference of the two.
And is there sort of a set list of legally allowed services, or can somebody say, hey, this should be a related service for my child? Like, what about this?
Yeah, I mean, I've had, parents request HIPAA therapy, which is the horse therapy and all kinds of fun things. So unfortunately, there are limitations. There is a pretty set list. And I'm not sure if we're going to list some of those now or if we're going to go through that later, but
you can throw out the list now, and then we'll dive into all of those in just a minute.
So transportation is, a very common one, right? In order to access your specialized academic instruction, you have to be able to access the location in which they'll be provided. So transportation would be a related service. Speech language therapy, occupational therapy, physical therapy, vision services, orientation and mobility, recreation and leisure. That's one oftentimes parents aren't aware of. DHH, so deaf and hard of hearing services, behavior intervention services, assistive technology, individualized intensive education or one-to-one aid.
How do parents know if their children actually need related services? Should the school be offering us all of the available appropriate related services during our IEPs?
Right. So it really comes down to, I guess, starting with your qualifying initial eligibility meeting in which you find out whether or not your child qualifies for special education, right? And assuming your child does qualify, then every 3 years, give or take, you're going to have that triennial or that re-evaluation. So every time your child is evaluated, you want to utilize that information to really determine kind of your child's strengths and also your child's areas of need, right? And so, and also eligibility. So one would obviously assume that if a child or a student is qualifying under speech language impairment, they're obviously going to need speech language services, right? Some related services are a little bit less clear cut. There isn't necessarily a section in that assessment report that directly speaks to like assistive technology, for example. So how do parents know? It's really a matter of kind of knowing and understanding your child and what can benefit your child. Like, hey, my child does better typing than handwriting, right? So can we talk about that? Unfortunately, I think parents are often uninformed or maybe misinformed about whether or not that is something that's available. And that's where it becomes a challenge. Parents don't know what they don't know. And so then the question is, should districts be informing parents of this at the time of those assessments? Of course, that should be happening, right? If there's ever an area of suspected need, that should be kind of laid out on the table. Hey, we think that this is an area to consider. We notice that your child is struggling with gross motor. Do you want to, adaptive PE, that's another related service. Do you think you would be interested in an APE assessment? Is that what's happening? Usually not. And again, if parents don't know that that's an option, that's where things can kind of go amiss. And then you don't know that your child could have had access to that related service. So opportunities such as these where we're kind of sharing that information is really helpful, where parents can be informed. And you don't have to just wait for those evaluations. Anytime throughout the year, if you're feeling like, hey, my kid's struggling in reading and he's just not getting it, an assistive tech assessment might be worthwhile. Put in that request and then, they'll assess. Can
the district say no to those requests?
Yes. So legally, what would happen is anytime a parent requests an assessment or a caregiver, the district they're going to respond in writing either way. They're either going to grant the assessment, in which case you'll receive the prior written notice and the assessment plan, right? Or they're going to deny the assessment. And anytime an assessment is denied, they have to provide in writing the reason and rationale via prior written notice as to why they're denying that assessment. And they have to have a really strong rationale. So the only time I've really ever seen that happen, which has been very rare, is really when there's just no logical explanation as to why the student would need that, like they aren't struggling, they're doing well, there's really no data to support a need for that area. And so in those cases, they may deny, but 9 times out of 10, it's going to get, granted, because if they're denying that assessment, they can be liable, right, for if that student could have benefited from that. So how do they know if they aren't assessing?
You might have said this, but we might want to expand a little bit on educationally appropriate, because let's take PT, for example, which, I know we're going to talk about in a second, but you can have all kinds of PT, private PT that covers, certain things, but in school, all of these services only cover things that are, is it educationally appropriate, or, how it relates to school. So how should parents sort of set those expectations?
That's a great question. It has to provide meaningful educational benefit. So I would say physical therapy, occupational therapy, and speech language therapy are probably the most common in which there can be that confusion. Parents will often say, well, my child's receiving this service, outside of school through their insurance, and they're working on, dressing, and they're working on, ambulating around the street or what have you. And so it can be confusing for parents if a child is receiving that service outside, but what the schools and the districts are required to provide is PT services or OT or speech language that allows them to access their education. So what that would look like for PT specifically is, are they able to ambulate around the campus? And that does include, like the play structure. It's not just getting to and from their classroom or the major, points on the campus. It is anywhere they may need to go, to include being able to safely access the play structure in the playground to play amongst their peers, right? Being able to get to and from the cafeteria or the office. So all of that is included. If there's uneven pavement, are they able to ambulate and navigate that? So looking at all of those pieces, also, sitting properly, are they bumping into things in the classroom, or are they able to maintain their, posture in the seat and all of those things? That's what they're looking at. Whereas medically necessary may be looking at other things. And so it's not going to directly translate, it's not going to be identical to what they're receiving outside necessarily.
What about a standard? I was thinking about that because I know other families have asked for that and sometimes get pushback if they want their child to be, stretching out and standing, and not, if their child is able to do that, they want them to be able to, get out of their wheelchair and be able to stretch or stand, even with that support in class. Is that something that's appropriate that families can ask for during the school day?
Absolutely. I have a number of clients who have a standard written into their IEP, and obviously the PT would be the provider to support either consulting and collaborating with the, adults to ensure it's being used properly, showing how to get in and out, and or any direct services, fitting, the standard, all of that. Really quick, one more thing about standard. It just reminded me of low incidence equipment. Another thing for families to be mindful of is oftentimes the conversation will come with eligibility. If you have a low incidence eligibility, so like vision, deaf and hard of hearing, orthopedic impairment, that requires equipment, they'll often argue they should be on the front page. 9 times out of 10, that's probably appropriate. But if the student qualifies for multiple and that isn't deemed one of the primary or secondary, it's not required for them to receive the funding or to be able to fund the equipment. It just means that they wouldn't receive the funding from the source that they would like to receive the funding from, but they would still be able to fund the equipment if they aren't on the front page. So that's just something else to note.
Is there an advantage of having those written on the front page as the qualifying diagnoses versus not?
I feel like it's important because if it were me, I would want my profile to be as accurate as possible and to describe me as who I am. A lot of school psychs like to say, it doesn't matter. You've already entered the door to special education. You're here. Why does it matter? I don't agree with that. I mean, the teacher is going to look at it, and whether we want to admit it or not, it's going to give an immediate impression, right? And so I think it needs to be accurate. So I'm just saying that, that's always a conversation whenever equipment is involved. They would like to have that funding source, and it's not necessary that doesn't mean if that's not on the front page, your child won't receive that equipment. It would still be funded.
Can you have an IEP? Oh yeah, only for related services.
Related services.
Yeah.
Well, yeah, I mean, if your child only qualifies under speech language impairment and they don't need any SAI, then they would only have the case manager would be the speech language pathologist, and they would only have goals for speech and language, right? Now, other related services, no, you wouldn't have an IEP just for like occupational therapy, or like just for assistive technology. So again, because really related services are supposed to support the student in accessing special education, a 504 is generally more what we're looking at for like supplementary aids and services only. And you can also just have a 504 sometimes that would just have like speech language therapy on it, right? It's rare, but it can happen. Also in preschool, that's an option, a speech language therapy only IEP. But I would say SLI is probably the only one where the related services would be, or there would only be the related service and no SAI. Because yeah, like if you're having an IEP, let's say, well, for counseling, let's say the student has emotional disturbance. I'm just trying to think off the top of my head, my clients, they don't have any academic needs, but they have like social emotional goals. But then there'll be like SAI consult collab. So they aren't being pulled for like academics and they don't have academic goals, but the case manager would be the SAI teacher, and they would still be overseeing like data and making sure the teacher, if they have any questions or whatnot. So I would say counseling, speech and language.
Maybe DHH?
DHH, yeah.
Which is deaf and hard of hearing.
Oh, vision could be another one, yeah, because if I have a client who's legally blind, so she has obviously vision services for like Braille reader and all of that, O&M, so they have goals, but she does have an academic goal, but that could be, if they don't have any academic needs, for sure, she would still have access to the IEP. I'm thinking orthopedic impairment too, like, because you wouldn't necessarily have academic needs, but you may still have PT. So I think, yeah, it just depends on the individual student, right? I mean, based on the eligibility, like I said, that's really what kind of drives some of these related services. Obviously, if you qualify under, deaf and hard of hearing, you're going to have DHH. If you qualify under vision impairment, you're going to have those services. So it kind of drives some of it.
Definitely. I wanted to ask about occupational therapy, which is, obviously a really big one. So what are some common reasons that students might need OT services?
So OT, again, as it's related to educational benefit, looks at, I mean, the most common obviously is fine motor, right? So handwriting, being able to do your academic work and write on paper, or typing. A lot of academic work has just migrated to electronic and computer-based. So typing is huge. Also, OTs can support a lot with assistive tech. So you may not need an AT, specialist to necessarily be attached to the IEP, but the OT might be able to support any recommendations after that assessment, and they can support with that, like accessing Grammarly and Google Read and Write and those types of, extensions for the student to be able to access, reading and writing and whatnot. Another area, obviously, that OT support is sensory. So sensory regulation, being able to recommend, any sensory diet or accommodations that students might need to be able to best learn in whatever environment they're in, or anywhere on the campus. At recess, if it's overstimulating, they can support that. Also core strength and core support. And then another one that parents aren't often aware of that OTs support is even a level of emotional regulation. So OTs are often attached to goals related to like zones of regulation. They're actually trained pretty well versed in that, and they work on those types of goals to help the student recognize like what zone they're in and what coping strategies to use and things like that. So again, depending on the level of need for that student, but I've seen a lot of OTs attached to those types of goals.
Speech and language, obviously another huge one. One of, like you, I think, mentioned early intervention, one of the biggest I think, right? One of the biggest categories, or is the biggest category for IEPs especially. But what kinds of communication needs are covered by IEPs?
So for speech and language impairment, like the eligibility, so they look at obviously language, so receptive language, what the student understands, expressive language, what the student is able to express themselves, whether that's vocally, via sign, AAC, they're looking at that and from their ability to express. They also look at articulation. So that's an area that they support. They also look at pragmatic language. So how the student communicates with others socially, whether that's nonverbal or verbal. And then they also look at voice. So like the pitch and the volume and whatnot, fluency. So like stuttering is an example. I think that's pretty much it. So you'll see all of those pieces written into the report.
And where does AAC fit into related services for speech and language?
So AAC, augmentative and assistive communication, is generally thought to be used for students who may be non-vocal. It's obviously a supplemental form of communication. It's not necessarily meant to replace anyone's voice, although if someone genuinely cannot vocalize, it could definitely be their primary means of communicating. So if a speech and language assessment comes back for a student and it's a student who has pretty significant, expressive delays, because AAC would be a means of expressing, right? And or maybe they have pretty significant articulation errors that's making their language very unintelligible, particularly to unfamiliar people. That could heavily impact social interaction, right? If you're trying to talk to peers and they don't understand you, that could pose as a barrier. So that is, those are the occasions in which you may want to, as a parent or a caregiver, request an AAC assessment if that's not being suggested, right, by the team or the speech language pathologist. And it may or may not be somebody different. It usually is. There's usually someone who's kind of deemed that AAC specialist, but AAC specialists always have a speech pathology background, and speech pathologists may also be AAC specialists. It just depends on the district. So yeah, you can request that assessment, and then based on the recommendations, depending on what app is recommended, just make sure that whatever speech pathologist is going to be working with your child, that they are experienced and trained and well-versed, and they are capable of training everyone else, because it has to be utilized all day, every day, right? In order for it to be meaningful.
And so I think also important on what you said was, because we were told early on, like, oh, well, we can't work on articulation goals. It's like, but that's part of her being able to communicate. So it really can range everything from if your child does vocalize or if they're trying articulation, but to the social goals as well. Whatever communication system your child is learning, that is part of speech, language, communication, socialization, everything. So they can really work on communicating with peers, whether that's the actual words or the communication through AAC, or if it's just not knowing how to have conversations, right? And really practicing reciprocal conversation.
Absolutely. And another thing you'll see a lot is students may perform well on the standardized pragmatic scales, and they can answer the questions correctly, so they won't qualify. So make sure they're also including observations and really looking at the students' like language in real time and their real conversations with others. You can't just base it off of how they, respond in a one-on-one setting on some, I see that a lot, particularly for students with autism, and it's really frustrating. So yeah, just be mindful of that.
Yeah. And we just got a related question from Buzzy, who said the school did not provide assessments, but they provided AAC to my son as accommodations because that's what the private clinic had given to my son. However, recently my son has not been using it in school and even with the teachers. Can I still request to have him assessed even though he already has an iPad using touch chat?
Yeah, so if something is being entered into the school setting, and particularly if they're adding it onto the IEP anywhere in any section, number one, they're responsible for providing that equipment. So your child should be eligible to receive a device through the district that he or she can be using, all day at school. And they have to assess to determine if whatever is being used is helping that student access his or her education. And of course, part of that assessment should be collaborating with that outside clinic, right? Assuming you give them consent, which I would recommend doing. So there's consistency. And then making sure there's consistency in the utilization of it across settings. So at school and at home. And that's really, again, why you want to make sure that team is involved and those services are added to the IEP, like who's responsible for updating it, when new words need to be added, when they're doing a new lesson plan at school, that language needs to be added on there so your child can participate. Who's that person? So definitely request an assessment, and it should be added in multiple places, not just, I think he said, on the accommodations page.
Just because your child already is using an iPad doesn't mean that the school then is like, great, you're good. We don't need to do anything.
Yeah, that just tells me that they're not doing what they should be doing to make sure that he should be accessing it the way he needs to be during the school day. And they obviously aren't doing training for all the, adults that he's working with on campus. They're not updating it. So definitely pursue that assessment.
I know you already, you had mentioned assistive technology, but as we've mentioned a lot, it's a really often misunderstood related service. So can you first explain what that encompasses?
So assistive technology is pretty much anything that the school needs to purchase to ensure that your child has access to the gen ed curriculum and or the special ed curriculum. So it can be considered a supplementary aid and service or a related service. Like an AAC device would be more of a related service because the individual would then be receiving like speech and language to help him navigate that, right? So literally like a pencil grip is considered assistive technology, your hearing aids and batteries, assistive technology, a calculator, even making charts, like special charts for your child. Anything that has to be purchased or made is technically considered assistive technology, low tech, right? So yes, your child has an AAC device. For every student who has a device, they should also have a low tech counterpart, because what if the device breaks? What if the device is dead? What if there's a power outage and they can't charge it and it dies? So they have to have that low tech component. That's AAC. So yeah, oftentimes districts don't check the box. They say, no, they don't need assistive tech. And then you go to the accommodations page and there's a pencil grip and adaptive paper and a calculator. Like all those things are technically assistive technology.
And a lot of those, the low tech options that you just gave, they can really be utilized from an early age, on to however long the student may need them. But then when should parents think about sort of the more high tech or the computer assistive technology assessments? Because I know when we started, it was told, we asked about it. It was never offered. And then we asked, it's like, oh, you should wait until about 4th grade. And I know, some of the kids, they're not using computers until that time. But when should parents start thinking of that? And how does that look like? What does assistive technology with a computer look like?
Yeah, again, I think it depends on each student and the eligibility. Like if, there's students with vision impairment, they're going to have access to certain types of assistive tech and low incidence equipment very early on, because that's the nature of their disability, right? Now, if we're talking about a student who has like a learning disability or a hypothesized learning disability, like dyslexia is a big one, in which maybe they would benefit more from having access to like text to speech and, Grammarly extensions and Google Read and Write for, supporting like dysgraphia or things like that. I think the general reason you start to see those types of options come out like 3rd grade and after is because reading, right? Like you start to reading tends to kind of really stabilize out, if you will, in the sense that if a student is struggling by 3rd grade and 4th grade, then they're probably going to continue to struggle pretty heavily. And that's really when you start to see how significantly that struggle is going to be. So oftentimes districts like to try like response to intervention and lower tier interventions up to that point before kind of saying, maybe this student needs an IEP, maybe we should assess, maybe we should look at alternatives. So I think that, and state testing, right? State testing also happens around that time. So, I think it's a case-by-case basis, depends on how significant the student is in terms of struggling before then. But, if you're feeling like it could be of benefit, then definitely request it. Adaptive scissors is another assistive technology tool. So either have the OT look at it or have an AT look at it. But it's not just for reading and writing, it's helping the student access across the board. There's so many things out there that we often don't even know exist, and an AT specialist can be super helpful for that.
And how are those minutes delivered? It's a little different than OT or PT where you're getting weekly minutes, or is it not?
No, generally it is. It's more of a consult collab model. They're generally there to assess and kind of make recommendations for equipment, right? So, the student is struggling with cutting. Maybe he's had OT for 2 years and he's stuck on the same goal. Let's look at this different type of tool. Or the student has been struggling with reading. He's not making progress. Let's look at this. An adaptive keyboard. Maybe let's try this. So it's not necessarily often that they're going to be providing any direct service as much as just making those recommendations and then training and consulting with the staff to make sure that they know how to properly implement and provide that equipment. That's not to say, like, I have AT specialists written in for monthly minutes for like a client who has vision impairment, and she supports with some of the equipment ongoing for that to make sure that they're supported. So it's a case-by-case basis. Definitely AAC. Sometimes AAC is under the AT umbrella. It depends on the district, and sometimes it's separate. But, are they going to be providing that ongoing direct support to the student to help them navigate the AAC device, or is it going to be the, in-house SLP? It just depends on how the district's, model looks.
So if you could really talk about staff and parent training and how parents should think about that and how they can request that in their IEP.
Yeah, absolutely. So I think the biggest one for me is definitely whenever AAC is recommended, it's like, okay, when is the training going to happen? Let's schedule it before we end this meeting. What date, how long? And parents need to be there as well. And also any in-home providers, bring your in-home ABA. I mean, with AAC, that's literally their voice usually, right? Again, depending on the student, but everyone needs to be consistent and everyone needs to know how that should be utilized. So definitely scheduling that before you leave that meeting with that person, because they are generally very busy. There's not many of them. And then if you feel the need for ongoing, make sure that's written in as like a yearly ongoing service. And I also write into my clients' IEPs that not only like a beginning of the year training, because obviously at the beginning of the year, there's going to be a new teacher. So we need to keep that up. But anytime a staff leaves. So again, I just had this last week, the SDC teacher left and now they're searching for a new teacher. And this particular student's AT, not AAC, but we need to have that person trained like as soon as they start. So we don't just want to write it as at the beginning of the year, but also anytime a new staff starts, they need to receive that training as soon as possible. Also, assistive tech, because students are going to need to access that at home for homework. So parents need to make sure they know how to support the student and they know what's going on and how their child is learning. So same thing, get that written in to the IEP. And then just really for any provider, I mean, it doesn't necessarily have to be ongoing, but another thing that's big that I think is frustrating is there's all these, visuals and tools being used at school and parents have no idea. And then they're coming home, the student is coming home, maybe doing homework or what have you. And parents are like, well, I didn't know that that's how he was getting through it in the classroom. Can you send home, a copy for us to use here? So consistency is huge. So that may not be training, but consistency, send home the visuals you're making, what pencil grip does he have at school so I can have one at home. I'll buy my own or whatever, or you send one home, but making sure parents know they have the right to access all of that, to have it at home for that student as well, particularly during distance learning too, right?
I'm having flashbacks as you're talking about someone who's no longer in our district, but said, oh, you don't need parent training for assistive technology. You don't need it. It's just, she just uses it at school and, it doesn't matter. I'm like, yeah, I want to come. I just, we want to learn. Yeah. We want to know, because again, like you said, I think it's really important for parents. You can't support your child at home for anything they're doing if you have no idea what's happening in school. So it's really, I think this is one of the most underutilized resources that parents can really write into their IEP, is that you can be trained, you can be there, you can be asking questions. And when you're talking about staff, that's aides too. So if you have an aide that leaves, then they need to be, retrained by, whomever it is on whatever it requires, whatever they require.
staff. And that goes for any related service provider. Again, I'll ask in IEPs all the time, like even with the PT, the way they physically prompt and they help guide. Oh, can parents come for a few minutes after school when you're there so you can model that? I mean, you don't necessarily have to have a full training, but those pieces, those little pieces can make such a significant difference. Like if your child is able to have access to that same type of support all day versus just for, the time they're at school, imagine how much more progress they can make, right?
Mhm.
And it's interesting, my sister lives in Texas. She's, has autism and anxiety, and out in Texas, first of all, they're not called IEPs, they're called ADRs, which totally blew my mind, or ARDs, I'm sorry, ARDs. But they offer legit in-home parent training, like in their programs. Like we will come to your house and provide almost like in-home ABA parent like consultation through insurance type. That's through the IEP. So I'm like, or through the ARD, right? Why can't we get that out here? Like that would be phenomenal, I think, for many cases to kind of bridge that gap, right? And also not just because I think parents need it, but do you know how many parents, if they were allowed to go into the school to support behavior, it would be a mind blow, like, oh my gosh, I didn't know that's all I had to do. But parents, like 9 times out of 10, know how to support their child's behavior better than the behavior specialist. And if they were allowed to go in and say, let me show you this, let me model this, oh my gosh, so many things could be resolved, right? Versus us having these meetings, writing these long BIPs and thinking we know everything. So if the specialist could come into the home and see how things are done, I just think it would be like the biggest help in the world, but I digress.
California, we have some work to do.
Let's get with it.
Let's do it.
They also allow video cameras in the classrooms out there.
That's exactly another whole subject that we could talk about. Yes. We also just had a question come in from Rodora. She said, can you ask for training with the teacher on the teacher weekly lesson to train the parent on how to implement specifically with their child? So it's kind of academic training, like whatever they're doing for the week. Could a parent request that?
I don't think so personally. I think that would be asking a lot. I mean, I'm not going to lie. I mean, if to expect a teacher to sit with you every week to go over the lesson plan, imagine how much the teacher is already doing. So I think we also have to be mindful of like realistic expectations and what the teachers can handle. I mean, if every student in the class asked for that, that would be a lot. However, you can add front loading of new content or new vocabulary or whatever it is you think your child needs as an accommodation. And then the teacher could then send that information home. Like, let's say, they start the new weekly lesson on Monday, then your child would get it sent home on Friday. So you can practice and have that exposed a little early, that type of thing. Mm-hmm. But yeah, I mean, it's the teacher's job to teach. So they would be the ones that would be responsible for teaching the lessons anyway.
So one of the biggest related services that parents want to know about is aids. So number one, what kinds of aids are actually available for kids at our school? And number two, how does a child qualify?
A brief summary. Aids, yeah, one-to-one aids, how those are offered. It's generally said that it requires an assessment. I personally think an FBA is more useful than the kind of generic one-to-one aid assessment, but every district calls it something different. It may be a RACIA, a SCACE, a SKIA. It's all literally the same thing. They've all used the same rubric. So there's 4 areas that they look at. And generally the person who completes the assessment is the school psych, but there's really no like qualifications for completing this assessment. It's not standardized, it's strictly observation based. And then there's a rubric and it goes from 0 to 3, I believe. 0, 1, 2, 3. 3 being the highest level of need, 0 being like the lowest level. So there's health, behavior, instruction, and inclusion. And so health is obviously health. Like, does the child require medications to be administered at school, or do they have a G tube or things like that? Behavior is behavior. So looking at, is there a behavior intervention plan? Has there been an FBA? Is there a comprehensive BIP? Are there social emotional goals? Instruction is access to instruction in the classroom, and then inclusion is socialization. So those are kind of the 4 areas. And if you kind of take that really speaks to the 4 ways in which an aid can be offering support, more or less, or the types of aids, right? So there's obviously health aids. Like there's going to be students who need either a nurse, that's another related service, by the way, nursing support or an aid to support health needs, depending on the severity of those needs. Then there's aids that are specifically implemented and in place to support behavior. So they're there to kind of support the implementation of strategies written into the behavior plan or whatever behavior strategies have been agreed upon within the IEP, and to ensure that, you know, those things are kind of being offered when they should be throughout the day. Then there's instructional aids or academic aids, if you will. So those are the aids that are there to more kind of help the student stay focused and on task and be redirected and attentive to instruction. They are not to teach the student. They are there just to keep the student on task so they can listen and learn from the teacher. And then there's aids to support socialization. And generally, I don't think I've ever seen an aid that's just for socialization. That's generally because there's like behavior or even just lack of attention and struggle with focus. But they would also then, let's say like there's an academic aid. Obviously academics aren't happening on the playground, but maybe that student also requires supports with socialization. So that same aid would also stay all day as opposed to just during instructional time, right? And also facilitate that social interaction. And aides can also be there on the bus. So they may actually have more minutes than the instructional day if they're starting, you know, bus to school and then taking them home.
Is there a specific training that aides must have to work with kids who have ADHD or ASD?
So that's a question parents often ask, right? What's the credentials or certification, or what trainings has this aide been through? I'm not gonna lie, it ain't much. The minimum requirements for an aide is a high school diploma. And then, yes, I will say this, depending on the utilization of the aid, it's not so much specific to the eligibility as much as it is to the purpose of the aid. So for aides who are there for the purpose of behavior support, they should be receiving a minimum number of hours of like ABA training before they start with, you know, whatever student they're supporting in that role. And they should be receiving that ongoing training. Some districts actually have RBT level aides, which is a registered behavior technician under the oversight of BCBAs. So it just depends on the district, but those would be like the deemed behavior aides, right? And their specialization is behavior. So they get that training. Other than that, I mean, obviously the health aides would have whatever training they need to support that student from the nurse or what have you. But other than that, there's not like specialized training. Let's say your child is fluent in ASL and they need an aid to support some of like that piece, or they're not fluent in ASL, but they need just some sort of support with that type of interaction. It would kind of fall more under social. They would get training on how to ensure that they can communicate and interact with your child, right? Or same if your child uses AAC, they would get training on how to support your child and make sure they receive that same level of AAC training that's written into the IEP. So it's more individualized, but you can request that your provider be educated on how to work with students with autism. Or if you have a specific training you want for ADHD, you can always request it, but it's not like a requirement for the job.
But what about the instructional aid? So what is that something that you can get for a one-on-one instructional aid, or is that usually a classroom aid that, you know, make sure that your kiddo, maybe other kiddos, you know, they could kind of float around and they come in as needed?
No, you can get a one-to-one aid for the purposes of supporting instruction or academics. So there's like students who have autism or who may have ADHD. Those are popular ones in terms of struggling with focus and remaining on task. You know, and so it's not so much behavior and that they're, you know, purposely, let's say, you know, getting up and walking away or not listening to the teacher or what have you. That's more what the behavior looks like in this rubric, is more like, you know, overt, seemingly intentional behavior. Whereas when you have ADHD, it's part of your, you know, disability in the sense that you're going to struggle with being attentive. So you may just need that person there to remind you of things, organization, executive functioning, remembering to grab stuff, remembering to pull things out, just kind of that level of support. Again, they aren't there to instruct the student per se. They're there to ensure that the student is accessing the instruction of the teacher. Whether or not that's the way it's being utilized, that's a whole nother story, but that's what it should look like.
What about districts who say that you're not allowed to talk to your aide? I mean, and I'm just seeing like parent after parent saying like, this is who's with my child all day. I'm not even like told their name half the time. Like, how can we, can't we say that we want to be able to talk to the aide? How can parents deal with that?
I totally get it. And I'll say I see both sides. Okay. So as a parent or a caregiver, I highly recommend that when you do have the opportunity to interact with the aide, that you do it in the way that it should be done. Because what's happening is parents are bombarding aides, and I'm not saying all parents, but it happens, and trying to get information out of them and trying to find out what's really going on. And then I get calls like, I can't say who told me because she'll get in trouble, but the aide is telling me what's really going on. So obviously that's why this happens, right? I mean, schools are being held liable, and they're not going to want interactions with parents and people, professionals. And it's not just in schools, it's the same for in-home. If you think about the dynamic, right? You have the supervisor and you have the therapist. The therapist, just like the aide, isn't as highly qualified and trained in interacting and communication and knowing what to say and what not to say. So they're the lower level tier because they don't have as much of that training and that background, and they haven't gone to school for all of that. So, that's also part of the reason. They might say the wrong thing, or they might not use the right terminology. And then parents are going home like, oh my gosh, what's happening? And maybe they just said it the wrong way. But on the flip side, parents can be sneaky and try to get information, and then it puts, the teacher in a awkward position. And so then the aid isn't being utilized properly either. So I get it. You want to know what's really going on with your kid. And I don't hold that against you. I'm a parent. I would want to know too. But go in and do observations. Send someone else in to do observations if your presence is going to change, your child's performance. If they see you, request monthly team meetings, have it written into your IEP. You can ask the aide to be there. You can ask for the aide to come to the IEP, by the way. Those are the appropriate ways, I think, to have those discussions, or ask to talk to the aide with the teacher present. If you have specific questions, those are the right ways to have it be done. It shouldn't be for the purpose of trying to get information out that you otherwise feel you wouldn't have, if that makes sense.
It does. And I mean, we had to request that in elementary, and that's exactly what they allowed. It's like, look, this person is in the bathroom with my daughter. Yeah. They're in there's no way I'm going to let somebody be in situations like that with my daughter without being able to speak to them. Yeah. But then, so we could have those conversations after class when the teacher was there. Yeah. But it's hard. As a parent, when you feel like, nope, you can't talk to anyone, and that's why, are they going to say something? But it's such a hard barrier. It feels like it's hard to build trust when you feel like something is being hidden.
I was just going to say, I feel like it all circles back to trust, but for both sides, right? Yeah. Like, I think it's just, and then it becomes this cyclical ball of not being able to trust both ways. Whereas, I get it. I think that if we looked at it from the perspective of, this is a very young person, usually maybe even older, but they aren't necessarily in a position to answer certain questions, but can we speak with the person that does have that credential, have that supervisor there, make it easy, and ask for the aide to come to the IEP. And if it's during the instructional day, you have to be willing to allow your child to have a substitute aide. I mean, just because obviously they're in the IEP, but absolutely that can happen.
Well, and when for aides, especially behavior aides, usually it's the case, but I guess for any of the services that we're talking about, when is it appropriate for a family to request a private or non-public agency to fulfill their child's related service versus using the district provider or aide? So that could go for any of it, right? OT, PT, yeah. Behavior aid.
Yeah. Another really good and popular question. Absolutely. It can be any service, not just behavior, the one-to-one aid. The number one time or occasion is obviously when they don't have someone available. So then you would have a contracted outside agency provide that service. The service provider's on maternity leave, and so they're going to have a gap, or, just out of the blue, someone leaves. I mean, that happens, life happens. And so you can absolutely look for or put in the request for the contracted outside agency if they haven't been able to find someone in an expected amount of time. And you don't want to just keep building up those bulk comp time hours. And obviously, simultaneously your child's just not receiving that service. That's not okay. Definitely the most popular request I get is for the one-to-one aid to be provided through an outside non-public agency. And usually for the purposes of that behavior aid, it's that behavior type aid. Generally because of that trust, they prefer their in-home agency to also provide that one-to-one support, or they just feel that, outside agencies are better apt to provide that level of service. And so it depends on the student. Obviously, it's a case-by-case basis, but generally what, the answer is the district always has the right to provide their own personnel first to provide that service. If and when it comes to be that inside or in-house personnel isn't equipped or isn't able to provide isn't able to provide the service that's allowing meaningful progress for your child, then you have more of a leg to stand on to kind of say, look, we tried your people, it's not working. My child's behavior isn't getting any better. We want to go, with this outside non-public agency.
It is so hard to know that you're setting them up a lot of times for possible massive failure before they can get what they need.
To be fair, I will say there's also downsides to having an outside agency. I feel like I have sort of a benefit coming in because I'm a behaviorist, and I'm also somewhat non-traditional. I'm not like a super radical behaviorist who thinks we need to whip kids into shape and be like the rest of us by any means. I'm very much the opposite of that. But I'm obviously very well educated and well versed on it. And so I kind of am able to see things that probably most people couldn't. I think most of my clients who have ever requested it have gotten it because I have the argument that they need. But also, I also am very well able to see when districts are doing a good job. And I do think that, it's hard. I have those conversations often with parents, not just for behavior, for anything. Like, so you're telling me that my kid needs to fail first, or we need to let them fail on my child. And it's like, no, not necessarily. I know it sounds that way, and to an extent, maybe a little bit, but we definitely don't need to let it go on for too long, for sure. You just have to know what to ask for, and you have to be on top of it and make sure you're holding them accountable to get you that data every week and make sure the data looks solid and sound. And if there's any question, go in and observe. It does sound frustrating, but it works. It works.
Right.
And there are often occasions in which their staff are great. I don't agree that it should always be an outside agency. There are many district staff who are phenomenal and they do a great job. And sometimes when you just have that person coming in to hold them accountable, maybe they're doing a little bit better job, and that's not right, but they're doing it and they're doing it well. And so,
is the goal to reduce services as the years go on?
Related services?
Yeah. Yes. But like, OT, PT, speech. I know when we started, it was like, just know that, the whole goal is that your kid gets less every year. And at the beginning, it's like, okay, I heard that enough times. I'm thinking, and then as she's getting older, it's like, yeah, these needs don't go away. She's not growing out of it. And if anything, like as things get more challenging, they could need more supports. Or if you're trying to do, inclusion and they need those supports, whatever it might look like, it's a common myth that parents are told when they're starting this journey. So I'd love for your thoughts on that.
I think I see that a lot with OT personally, more than any other service. It's like, well, we've been working on writing her name for the past 3 years and it's not working, so we're not going to provide service anymore. It's like, wait, what? No, the goal is definitely not, I guess, to get rid of related services. I guess I would say the goal would always be for the student to have access to their least restrictive environment, right? And so, yes, the more services they have that are not within their general education setting, they're being pulled out and not in their least restrictive environment. But the student needs what the student needs. And so if a student is working on the same skill year after year after year, obviously something isn't working, right? We don't just want to keep doing that over and over and over. But you're right, like needs should change because as students age up, they're doing different things. And so it may be the case that yes, OT isn't needed anymore for writing her name, but now she's in high school and she's using the Chromebook more, and we need to work on typing and learning how to navigate this, that, and the other. So yeah, if there's a need, then the student should have access to the service. But if there's no longer a need, then that's not a bad thing, right? And maybe it's just consult and collab. It's again, a case by case basis.
How do we know what our kids are working on, or if they're actually getting the minutes that are in their IEP?
Yes, another great question. So for related services specifically, you definitely have the right to request the data. First of all, look at your IEP goals. If it's ever something that's tangible, always make sure that they're written as measured by work samples, because then the data will always be the work that they're doing. So if the OT goals are any form of writing or typing, technically that's a work sample too. You can literally receive that as the proof, right? Now, if it's a goal where it can't be tangible, like a counseling goal and they're talking and giving, talking about coping, that's different. It's a little harder. Ask for service logs. You have the right to the service logs, and the service logs aren't as great as like real data, but it'll still have the date and the time and what they worked on. And you can gauge that. I mean, if your child is able to just straight up tell you that's the best, like I haven't seen that person since last year, like, oh, great. Okay. And that's happened to me twice in the past week. Again, observations. You have the right to observe speech and language sessions. If they're in group, that's still a public school. You can still go in and observe a public speech and language session. If they're in a social skills group, you can still go in and observe. If they're in an OT group, you can still go in and observe. And again, if your presence will change that, your child's behavior, send a blind observer, send someone that they don't know is there for them, that you trust, obviously.
Push in versus pull out. How should parents think about service minutes, with those two things in mind? What should they think about when making those decisions?
Yeah, so push in is when the provider's going into the general education class, or I guess whatever classroom your child is in and providing the service there, whereas pull out is they're being removed from their classroom to meet with that service provider, generally in their location, or maybe if it's PT, you'd be on the campus or whatever, possibly. So when it's push in and it's push in into the gen ed class, that's not going to change their percentage of time in gen ed. So that's one thing to be aware of. But also in terms of whether or not it's going to be beneficial for your child, is your child able to focus, and are they able to learn whatever skill they're working on, whatever that goal is that they're working on in that type of environment, right? If your child gets very distracted, or they lose focus, or you feel like it wouldn't be intensive enough, like practice, then, you're going to opt for more of a pull-out model. And the same is kind of to be said for, should it be individual or should it be group? Like with speech language, that's a big one. I feel like my child needs one-on-one. Why are you offering group only? There are occasions in which it makes sense. Obviously, if it's a social goal, they should be with peers, not with themselves, but also be mindful that, there's shortages. And unfortunately, there are providers out there that are trying to push just group because they don't have the time to see kids one-on-one. And if your child needs one-on-one, then push for one-on-one.
Can a school refuse to do push-in?
If the provider's pushing in, especially if we're talking about a gen ed class, I mean, really any class, but they're going to be working on whatever the teacher is teaching at that time. So like, let's say the OT is pushing in and they're working on typing. It would make sense then that the OT would go in during an instructional time in which the class is working on typing an essay, let's say. They wouldn't go in when they're doing math, and they're not pushing in to then work with your child like in the corner one-on-one. They're going to be pushing in to work with whatever is being done that makes sense for that goal. If there isn't something that's being worked on anytime during the day that would make sense, like let's say your child is mainstreamed in 5th grade, and maybe they're working though on writing his or her name. That's not the best example, but yes, you could write your name, but like how many times are you going to write your name for a 20-minute session push in, right? Like, and the OT can't like completely veer off from what's being done in class, then it really wouldn't make sense. That to me would be more of a need for pull out. Mm-hmm. So they cannot deny push in, but it has to make sense based on what the goals are in the IEP, and can that be worked into that push in setting, if that makes sense.
Yeah. And for pull out, can we stipulate like times that we don't want our child pulled out?
Yeah. So like, obviously you wouldn't want your kid being pulled out from really important, like core academic time, right? You want to make sure they're not missing that core academics. So generally, particularly in like middle school and high school, specialists from what I see are really good at pulling from like PE or elective time. And oftentimes students don't prefer that because that tends to be the more fun classes for them. But then simultaneously, if they were pulled during those core academic subjects, they're missing a lot for that 20 minutes and then they're behind. So absolutely. And the same can be worked around in elementary school. You know, it's obviously a little different because it's one teacher all day. So you just look at the times. And if the provider is like, sorry, I already have my schedule set, you know, say, sorry, that's not my problem. Like my child needs to be seen during whatever other time. Let's make it work.
You can definitely put that, because I think a lot of things, it's like, well, we just sort of do whatever we can because there's so many kids, but you can really push and say, absolutely not. We don't want them being pulled out of academic.
Because then it's impacting them and then they're going to be behind in the other area that they're already behind in, right? And that's not helpful.
We kind of hit on some of the, like, you know, the lesser known, related services, DHH. We talked about O&M, O&I, low vision. I just threw out a bunch of acronyms. So if you want to just really quickly touch on those, and then I have a follow-up to that.
Recreation and leisure is probably my favorite secret one. It's an assessment that I don't think most districts have a real designated person to conduct, but that's really to look at like social skills and just ways in which a student can benefit socially, recreationally during leisure skills and leisure time. So that's a really fun one. If you have a student who's struggling maybe at recess or at middle school, it's so hard, right? They don't have a playground anymore. And it's like, what does my kid do now? Like they're struggling with communication socially. So that's a great one. Look it up if you're not familiar with that. Adaptive PE, if your kid is struggling with gross motor, and you can get that as early as kindergarten. It doesn't have to wait until like there's designated PE, class. It can be as early as kindergarten to support like that gross motor development. OI, that's orthopedic impairment. So whenever a student is designated or they qualify under that eligibility, orthopedic impairment, they should have an OI specialist attached to their IEP. It's not necessarily a direct service, but they basically kind of are the expert, if you will, in that eligibility category and kind of help, support whatever needs that student may have. If a student qualifies under vision impairment, they can also be considered for orientation and mobility services, but the only way you can access O&M is if you qualify for vision services. So O&M is kind of different in PT in that they're helping the student navigate as it relates to their vision, if that makes sense. So like if a student has a walking cane, then they can help them learn how to utilize that and navigate even off campus. As an example, and even if they don't have the walking cane necessarily, but they can still help learn how to go like up and down the curb or up and down the stairs, but more for the vision, not so much like the physical motor reason. DHH, deaf and hard of hearing. So if your student qualifies under DHH, then they would have the DHH service provider, and again helping with if they have hearing aids or like a pass mic. So if there's the FM system and then also like a pass mic that can be passed around, because yes, the teacher is wearing that, but what about when the peers raise their hand and they speak within class? If the student can't hear them, then how is that helpful? So just making sure your student has accessibility to everything within the classroom that they should be.
I wanted to ask just about two educational things. Does educational therapy, is that a related service? And then inclusion specialist.
Oh yeah, inclusion. I was going to say inclusion specialist. I'll answer that one first. So an inclusion specialist can also be an additional layer of support, a hidden gem, if you will. Most districts still don't have one, which I think is definitely probably the most necessary support that every district should have at least one of. They should be a moderate to severe credentialed special education teacher, ideally having extensive knowledge and experience and background in like both gen ed and special ed curriculum, and how to provide that inclusionary support. So they would consult with the gen ed teacher and go in and help the gen ed teacher basically incorporate your child's goals into their everyday classroom, and also help the gen ed teacher modify the gen ed curriculum so that your child can access that curriculum. And it's just amazing to have that support. And yes, they can be written into the IEP. And if your district doesn't have one, yes, you can have them contract out. There aren't many, but they do exist. They're like unicorns. And education therapists, is that what you
Yeah,
said?
we had some people ask about educational therapy or tutoring, if that could be included as a, yeah.
No. So I get that a lot. The argument can be made to have the district reimburse you for tutoring, if you can prove that, there's a rationale for that. But other than getting like compensatory education, that their tutoring wouldn't be written into the IEP. If your child would benefit from counseling, there's definitely like the basic school counselor, which may work. And then there's like out here, we have kind of like free county-based type counselors that are interns, and the turnover is insane. It's not great, right? And then there's intensive individualized counseling. And so that's with a licensed therapist. Out here, we call it ERSES or ERMS, educationally related social emotional services, or educationally related mental health services. And that would be with like a licensed MFT or a licensed social worker. And then once you qualify for that level of service, it also opens up a door for co-eds or wraparound services. And so if your child is struggling like socially, emotionally, and that may be manifesting behaviorally as well, both in the home and in this school, kind of going back a little bit to parent training, co-eds, there's different tiers, one of which provides a parent partner, a student partner, and then a case manager. And you have like weekly meetings, and then the student partner can see the student at home and at school. And that's pretty accessible. Most districts that I've seen, some districts try to tell you have to do that through your insurance. It is not true. If your child needs it for educational purposes, then the district should be funding that. And it can be written into as a related service. And it can be really, really helpful.
And I know ours can be accessed through our SELPA. Eric's is what it's called.
Yeah,
in our SELPA. Yeah.
Yep. It's the same.
And it is very little known. So, and I know a lot of parents who have experienced it. It's made a huge difference for their kids.
And you don't have to have an emotional disturbance eligibility. It can be any eligibility.
Yeah. I mean, I've known kids with, extreme anxiety to where they don't want to go to school, and it's been, hugely helpful. And if you do want or need deeper support and a one-on-one guide to talk through what services your child is or isn't receiving, our Undivided navigators would love to help you through it, to help access the experts, to really bring the options to the table and talk those through with you. I know our navigators, many of whom are also parents, would love to meet you. And our mission is to support you so your children can thrive. So please reach out and let us know how we can help. And lastly, if you're not already a Facebook group member, join us. Our Facebook group is private, but open to any parent raising a child with disabilities. We'd love to see you there.